Most people discover they have arterial plaque only after a cardiac event. That's the problem. 70% of first heart attacks occur in people who had no prior chest pain. Arterial blockages develop silently, often for decades, and by the time symptoms appear, the disease is already advanced. But there are warning signs. They're subtle, they're often dismissed, and they're detectable right now. This is not about fear. This is about recognition and immediate correction. Clogged arteries refers to atherosclerosis, the process by which plaque accumulates inside the arterial wall. This plaque is not a single substance. It's a combination of oxidized lipids, inflammatory cells, calcium deposits, and fibrous tissue. The danger is not just the degree of blockage. A 70% blockage can remain stable for years. The real risk is plaque rupture. When the fibrous cap covering the plaque becomes unstable, it can tear. Blood clots form instantly at the rupture site, and that clot can completely obstruct blood flow within seconds. This is how heart attacks happen, not from slow narrowing alone, but from sudden rupture of vulnerable plaque. Symptoms are subtle because partial blockages don't always reduce resting blood flow enough to cause pain. You may feel fine sitting at your desk, but under exertion, when your heart demands more oxygen, the narrowed artery cannot deliver. That's when symptoms emerge. The challenge is that these early signals are easy to rationalize. People attribute them to aging, stress, or poor sleep. That delay is costly. After age 45, arterial stiffness increases, endothelial function declines, and inflammatory markers rise. The disease accelerates. This is why recognition at this stage is critical. The earliest warning signs relate to circulation. One of the most commonly missed indicators is leg cramping during walking that resolves with rest. This is called intermittent claudication, and it signals peripheral artery disease. The same plaque process affecting your heart is affecting your legs. If your calf muscles cramp after walking 2 blocks and the pain stops when you stand still, that is not a muscle problem. That is insufficient blood flow. Another early sign is cold extremities, particularly if one foot is noticeably colder than the other. Asymmetry matters. It suggests unequal blood delivery. Exercise tolerance is another key marker. If you notice that activities you performed comfortably 6 months ago now leave you short of breath or fatigued, that change is significant. This is not about comparing yourself to an athlete. This is about comparing yourself to yourself. A reduction in your own baseline capacity, especially if it occurs gradually over weeks or months, suggests your cardiovascular system is compensating for reduced efficiency. Fatigue that is disproportionate to effort is another signal. If climbing a single flight of stairs leaves you winded and you need several minutes to recover, your heart is not receiving adequate oxygen during exertion. Some people experience cognitive changes. Brief episodes of confusion, difficulty concentrating, or memory lapses can result from transient reductions in cerebral blood flow. These are not always recognized as vascular. They're dismissed as stress or aging. But if they coincide with other symptoms, particularly exertional fatigue or circulation issues, they warrant investigation. Dizziness upon standing, especially if it occurs frequently, can indicate poor arterial compliance or autonomic dysfunction related to vascular disease. Now we address the advanced warning signs. Chest discomfort is the most recognized, but it doesn't always present as crushing pain. Many people describe pressure, tightness, or a squeezing sensation. It may radiate to the jaw, neck, shoulder, or arm. What matters is the pattern. If the discomfort occurs predictably with exertion and resolves with rest, that is angina. It means your heart is not receiving enough oxygen during increased demand. This is not something to monitor at home. This requires immediate medical evaluation. Shortness of breath at rest or with minimal exertion is a red flag. If you wake at night gasping for air or need to prop yourself up with pillows to breathe comfortably, that suggests your heart is failing to pump efficiently. Fluid may be backing up into your lungs. Sudden, unexplained sweating, nausea, or a sense of impending doom, particularly in combination with any chest discomfort, are classic indicators of a cardiac event in progress. Women, in particular, often present with atypical symptoms. Fatigue, nausea, and upper back pain are more common in women than classic chest pain. These differences delay diagnosis. Awareness of this pattern is essential. Why do these signs occur? Atherosclerosis begins with endothelial dysfunction. The endothelium is the inner lining of your arteries. It regulates blood flow, controls inflammation, and prevents clot formation. When this lining is damaged by oxidized LDL particles, high blood sugar, smoking, or chronic inflammation, it becomes permeable. Lipids enter the arterial wall. The immune system responds by sending white blood cells to the site. These cells engulf the lipids and become foam cells, which accumulate and form the fatty streak, the earliest visible stage of plaque. Chronic inflammation drives plaque progression. Inflammatory cytokines weaken the fibrous cap. Calcium deposits make the artery stiff. The result is a vessel that cannot dilate properly under stress, and a plaque that is vulnerable to rupture. Insulin resistance accelerates this process. Elevated insulin promotes lipid storage, increases oxidative stress, and enhances inflammatory signaling. This is why metabolic syndrome and type 2 diabetes are such potent risk factors. The biological environment is pro-inflammatory and pro-atherogenic. So what do you do immediately? First, dietary correction. Remove refined carbohydrates and seed oils. These are the primary drivers of oxidative stress and insulin resistance. Refined sugars spike blood glucose and insulin repeatedly throughout the day. This damages the endothelium and promotes lipid oxidation. Seed oils, particularly those high in omega-6 fatty acids like soybean, corn, and sunflower oil, are highly susceptible to oxidation. Oxidized lipids are incorporated into LDL particles, making them more atherogenic. Replace these with whole foods. Prioritize fatty fish, which provide omega-3 fatty acids that reduce inflammation. Include fiber-rich vegetables that stabilize blood sugar and support gut health. Gut-derived endotoxins contribute to systemic inflammation, so gut barrier integrity matters. Physical activity must be addressed immediately but intelligently. If you have symptoms, you need medical clearance before beginning vigorous exercise. However, walking is safe for most people and profoundly effective. 30 minutes of brisk walking daily improves endothelial function, reduces inflammatory markers, and enhances insulin sensitivity. The mechanism is direct. Movement increases shear stress on the arterial wall, which stimulates nitric oxide production. Nitric oxide dilates blood vessels, inhibits platelet aggregation, and reduces inflammation. This is not optional. This is foundational. Sleep quality directly impacts cardiovascular risk. Poor sleep increases cortisol, raises blood pressure, and promotes insulin resistance. Aim for 7 to 8 hours of uninterrupted sleep in a dark, cool room. Address sleep apnea if you snore heavily or wake frequently. Untreated sleep apnea creates repetitive hypoxic episodes that damage the endothelium and accelerate plaque progression. Stress management is equally important. Chronic stress activates the sympathetic nervous system, raises blood pressure, and increases circulating inflammatory cytokines. Practices that activate the parasympathetic nervous system, such as deep breathing or meditation, have measurable effects on heart rate variability and vascular tone. Now, the mistakes. Many people believe that low-fat diets protect the heart. This is outdated. Dietary fat is not the enemy. Trans fats and oxidized fats are harmful, but natural fats from whole food sources like olive oil, avocados, and fatty fish do not promote atherosclerosis. In fact, they're protective. The real issue is the combination of refined carbohydrates and inflammatory fats, which creates a metabolic environment that accelerates plaque formation. Another mistake is focusing exclusively on LDL cholesterol. LDL matters, but it's not the whole picture. Particle size matters. Small, dense LDL particles are more atherogenic than large, buoyant ones. Triglycerides matter. A high triglyceride to HDL ratio indicates insulin resistance and predicts cardiovascular events more reliably than LDL alone. Sedentary behavior is another critical error. People assume that if they exercise for 30 minutes, the rest of the day doesn't matter. It does. Prolonged sitting, independent of exercise duration, increases cardiovascular risk. Break up sitting time every hour. Stand, walk, stretch. Movement throughout the day maintains vascular function in ways that a single exercise session cannot replicate. One underrated test is the coronary artery calcium score. This is a non-invasive CT scan that quantifies the amount of calcium in your coronary arteries. Calcium in the arterial wall is a marker of plaque burden. A score of 0 suggests very low risk. A score above 100 indicates significant plaque and warrants aggressive risk factor modification. This test is particularly useful for people with intermediate risk based on traditional factors. It refines risk stratification and guides treatment intensity. It's not commonly ordered, but it should be. The information it provides is actionable and prognostic. Arterial disease is detectable. It's modifiable. The warning signs exist, and you now know what to look for. Early intervention changes outcomes. This is not about fear. This is about informed action. You have control over the trajectory of this disease, and that control begins today.